The broadcast is now starting. All attendees are in listen-only mode.
Hello, my name is Mary Howard. I am one of the business analysts for the WebBGAS system, and I want to welcome you to the webinar for the 2021 PAIMI PPR. I want to let you know that this will be recorded and that the recording will be sent to SAMHSA to place on their YouTube website for review. Also want to let you all know that you're all muted. And so if you have any questions, we ask that you use the question chat box at the bottom of your menu. And we will be taking breaks throughout the system, throughout the time, to respond to those questions. Having said that, I would like to introduce you to Lisa Stallworth, the PAIMI Program Coordinator. Lisa?
Good afternoon, everyone, and it's good to be with you this afternoon. As Mary said, I am Lisa Stallworth, the PAIMI Program Coordinator. So thank you for joining today's webinar to review the PAIMI Program Performance Report, PPR, which includes the Advisory Council Report, ACR, for FY 2021. The PPR and ACR is due in WebBGAS by 11:59 p.m. Eastern Daylight Time on January the 1st, 2022, in accordance with the PAIMI Program statutory requirements. The purpose of today's webinar is to navigate through the PPR and ACR and point out the changes that were made to enhance the efficiency of data entry. When the opportunity is provided, please feel free to ask questions, and as you have been instructed, please include those questions in the chat box. Also, you may contact at a later time your assigned PAIMI program officer by email or phone with any questions that you may have while you are completing the PPR and ACR. In addition to this webinar, we have another joint webinar that will be coming soon with NDRN on November the 3rd, 2021 at 4:00 p.m. Eastern Daylight Time on preparing the ACR. So please plan to attend. Now, SAMHSA would like to thank the P&As for the services provided to individuals with significant mental illness or emotional impairment under the PAIMI program during FY 2021, despite the continuing challenges that resulted from COVID-19. So at this time, again, we say thank you and welcome to the webinar. Now we'll turn the session back over to Mary. Thank you, Mary.
Thank you, Lisa. To begin with, I want to let you all know that I am going to be using our what we call our UAT site. This is our test site. So all of the data you will be seeing is fake, but it is the same process. It's the navigation, same process that you'll go through when entering data. So let us begin. First off, I want to show you that when you come to the login screen, you'll see some information. For instance, if you forgot your password, you can click on this link and it'll take you through the process. The same goes for your username. Or if you need a new user account, you can click on this and it'll walk you. Here are the directions on how to apply for a new user account. You have to go through your project officer at SAMHSA to get the account set up. And this basically walks you through those steps on how to do that. Also wanted to point out that if you are ever in need of assistance in navigating through WebBGAS, if something isn't working right or you don't quite understand how to enter the data, you can always contact our help desk team by clicking on the email link here or by giving them a call at the 1-888-301-BGAS or 2427 number, and they'll be more than happy to help you. Now, as Lisa stated, I want to state one more time. If you need assistance in how to navigate in WebBGAS, that's when you call the help desk. If you need assistance on what data is to be entered and that kind of information, please contact your project officer. Our help desk is here strictly for how to navigate, or if you're having problems logging in or having problems dealing with WebBGAS itself. So I just wanted to point that out. All right, so let's go ahead and log in. Okay, now the first thing you'll come to is what we call the window shade, and it just has up-to-date information on what's happening in WebBGAS. So once again, here, if you need help, here we're stating that the PAIMI Program Performance Report is opening date notification, that it's open, and the information you need here. It gives you our monthly system maintenance information and also a little information on the different browsers. So once you've reviewed this information, you click on Close, and it brings you to the Welcome to WebBGAS screen. And here we have, you can view the Protection and Advocacy Agency state contact list and profile. You can create a new grant application, view an existing application, and then also, once again, run or request a report, change user password, or contact the help desk. Now, I want to point out that for creating a new application, you must be a supervisor to do so. If you are a state user, create a new application will not appear on your welcome screen. So if you're supposed to be able to create an application and you log in and it's not there, please contact your project officer about getting supervisory roles so that you can do that. I just wanted to point that out. The other thing I wanted to show you was up here on the toolbar here at the top. If you click on support and then come over here and click on training, it will take you to the site where all of the navigation manuals are located. And you'll note here, we have one for the PAIMI application and one for the PPR. So you can open these and save them to your desktop, and you can refer to them if you have any questions about what you're supposed to do next or how to get to someplace. So those are there for your use. The other thing I wanted to point out was the state P&A profile. Now, because of my permissions, I have that list. That will not happen with yours. But I'm going to pick Iowa here and click on Go. When you click on the state P&A profile, this is the screen that will appear. And what I need you to do is, before you go any further in opening the application or doing anything else, please come to this screen and make sure all of this information is correct and up to date, that you haven't got new staff or somebody's replaced someone. If they have, please update this information. And the reason is because when we get to the application itself, the general information screen, if you update the information here, when you open that screen for the first time, it'll automatically update the information. So you don't have to go in and do it again. So that's just an FYI for you. And we use this information for standard reports and other items for the users, who's a user, who isn't. So if you can keep this up to date, it'd be much appreciated. All right. Now, I showed you before the list of create an application or existing applications. We can go back there, or if I simply come up here to existing application, it's giving me the existing applications for Iowa. All right. And I'm going to select the 2021 PAIMI Progress Report, the PPR. You'll note over here on the far right-hand side, there's a print button. If you ever want to print out the entire application, you can use this print button and it'll do it all in one place. So I just wanted to point that out to you. All right. Here we are at your dashboard. And what this will do, it'll tell you what's recently been opened and looked at and reviewed or updated. And we also have here under related documents, we have a hard copy of the Advisory Council report, and we have the instructions for the 2021 PAIMI, PPR. And these you can take and you can, once again, you can open these and save them to your desktop and they'll be there for your use. Once you've done that review, if you simply click on View Application, it'll take you to what we call the Overview screen. And here we are at the application itself, the PPR, all the tables included in the PPR. You can click on them. You'll see the sections. And you can just simply click on the links from here, or you can go to the sections. You'll see down here we have each area is in its own section. Here, if you have any attachments outside of what is included as we go through the different tables themselves, you can simply come here to attachments and select the section it's for, and then go ahead and upload that attachment right here. So that you have right here. All right. So let's get going here. I'm going to go to this section. So the first form we have to look at is general information. And as I said, if you update the state profile, P&A, this information will automatically update. However, if you forgot or you missed something, you can always go in and edit the form itself. The form is editable. We haven't added anything or updated any of the information here. It's the same as it was for 2020. There are a couple items I do want to point out. If you want to just print this form itself, you can click on Print. Here we have the instructions just for general information. Each table has its own instructions. So you can get the full instructions under related documents, or when you get to the table, if you have any questions, you can always refer to the instructions right here. And as you can see, it opened in a second tab. So if you wish, you can leave the tab open and complete, and then always just click back on the tab or simply close it. Footnotes. At the bottom of each screen, you will note there is a place for footnotes. So you simply come in, click on the footnotes button, a screen will open, type in your footnotes, and click on Save. And then when I come back down here, come down to the bottom of the screen, you'll notice that the footnotes are there. So if you have any additional information you want to document, you can do it under footnotes. Also want to point out that you'll see here we have mark form as complete. Once you've completed this form, done the review, you're finished. If you wish, you can mark the form as complete from here. And you'll notice the button changes to mark as in progress. Up here, it tells you this section is now 16% completed, and that the entire application, we've completed 3 parts of it, 3% of it. You can do this on each form. So as you go through and complete a form, you can mark it complete from here. Now, you can still edit the form. You can still edit the form. This form the entire PPR can be edited up until the time it's submitted to SAMHSA. Once it's submitted, then the forms are no longer editable. And if you realize that you've made an error or forgot to add something, you'll have to contact your project officer and ask them to send you a revision request. And we're going to go over that at the end of the session. But just to let you know, the form remains editable up until that time. All right, now for the board council and staff demographics, To let you know, the data will be ported from the 2020 PPR and will be editable. So you can go in and update this information. You can go in and update this information. While I have you here, I do want to tell you that within the PPR, all fields are required. So if you leave a field blank and click on the Save button, you'll get a message up here, form was not saved, invalid form data. And you'll also notice here it says, please fix the following error. All fields must have a value, all right? And all the fields must use whole numbers. So you have to put in at least a 0 to save this screen. You must enter at least a 0 to save the screen. And that's the same for all of the tables in the PPR in WebBGAS. They're all required. For the governing board, once again, the data will be ported from 2020 and you'll be able to go in and update and edit the information. And we've made no changes or updates to this table. Executive director. These fields will be blank. The fields will be blank. You'll notice if I click on the calendar, one of the count date sections, a calendar will appear and you can use the calendar to complete the information. Number of mental health professionals on the advisory council. This table will be blank and you must enter the data. And we've done nothing or added or edited, updated this table. And finally, the PAIMI Advisory Council's assigned staff. Once again, this table will be blank and we have done nothing to update it. For demographics, population information, same as for 2020, no changes have been made and the fields will be blank. PAIMI eligible individuals served with PAIMI program funds. The fields will be blank and no changes have been made. Living arrangements of PAIMI eligible individuals at intake. The fields will once again be blank. And we have made no changes to the screen itself.
All right, Mary, if I make a comment.
You bet.
All right, so would you go back to the previous screen?
End outcomes?
No, wasn't you looking at the living arrangements? Was it the living arrangements that you were looking at? The section.
I'm sorry. I apologize. I went to the wrong section. I apologize.
All right, you can stay right there. You can stay right there. So on the demographic, when we look at these tables, we're going to look at to ensure that the number of individual PAIMI eligible individuals, the number is exactly the same on all three of these forms. So if not, we will send a revision request asking for correction or explanation. So when we look at these three forms under section B, the number of PAIMI eligible individuals should be exactly the same. If not, there should be an explanation in the footnote. Thank you so much.
All right. Now, areas of alleged abuse. You'll see here we have what we call a key. And what this key is for is explains what each of the columns stands for. So as you're going along and completing this form, you can always refer to the key to make sure you have the correct numbers and what you're looking for matches your needs for entering the data. As you complete each column, the total will automatically calculate and appear here on the right-hand side. It will also do the totals and complete this information down here for you. And once again, all the fields are required, so you must enter at least a 0. You must enter at least a 0. There haven't been any changes or modifications made to alleged abuse. Areas of alleged neglect, it's the same process, exactly the same process, and all the rules are in place. One thing I did want to point out for alleged rights abuse, alleged neglect, alleged rights, and alleged, alleged neglect. For each of these, all three of these, you are going to have to enter at least one case. At least one case. If you have more than one, you just simply add a new case and you'll have another field where you can enter that data. You can enter up to a total of 5 cases. As it says here, you can do an additional 4. So the first one is required. You are required to enter at least one. But if you have more, it's been edited so you can go ahead and add up to 4 more cases. And that is for alleged abuse, alleged neglect, and alleged rights violations. Just to let you know, those are required fields. And once again, we have the key, and this is for rights violations. No changes or additions have been made for rights violations. Reasons for closing individual advocacy case files. The fields will be blank. I've gone in and added data. The fields will be blank and there's been nothing added or updated. And once again, you'll see you have to enter at least one case. Intervention strategies. You have the key. We have included a header at the top of this. There appears to have been some confusion. So we have gone in and added a header here. The totals reported for the abuse, neglect, and rights violation outcomes of this section should be the same as the totals reported in the areas of alleged abuse, neglect, and rights violation tables. So the totals you find on the tables we just reviewed, that total should match the same as the totals that appear here. And once again, you have one required case of intervention that needs to be entered.
Hi, Mary. May I make a comment at this time?
Of course.
Okay, so in the intervention strategies, it was brought to our attention that the outcome of investigation was not included in the new PPR for this cycle. So with that being said, we have suggested and recommended already that if any of your outcomes fall under investigation, again, we're stressing that the totals from the previous 3 tables should equal up to this table. So if investigation is one of the outcomes and is not included here in this table, we're asking that you would include that information down in the footnote, and we will consider that number, whether it's an investigation on abuse, neglect, or right violation, as part of your total number for these intervention strategies. So what we're going to do when it's time for the new cycle, to prepare the PPR, we will consider putting the investigation back on as an intervention strategy. Also, too, for the cases, when you're preparing the cases, please be detailed and specific, because we do read them, because we need to determine that that case was a PAIMI eligible individual. So be specific in your information, not the name of the person. Of course, you can use initials if you would like, but be specific as far as what type of facility, if the person is in a facility such as a psychiatric facility, or if not a facility, again, provide some type of information such as specific mental health diagnosis, so that we can evaluate and confirm that these are cases related to PAIMI eligible individuals. Thank you so much, Mary.
Mm-hmm. All right. Death investigation activities. Once again, the fields will be blank. And you'll see here that it's asking for at least one case for number 3. It's one case is required, but you can add more if you wish. And we've made no changes or updates to this form.
Okay, Mary, I need to make a comment here, please.
Oh, okay.
All right. So on this form, number 1, it asks you to identify the source of where you receive information about death of individuals. So the first one is the state. The second one is the Center for Medicaid and Medicare Services, regional offices, and then other sources. So we are aware through monitoring visits that we had in the last 2 years, and then also some of the PNAs have reported to us that you are not receiving any reports from CMS. So you have to put a number in this field. So when you indicate 0, again, please let us know in the footnote if that 0 means that you receive reports from CMS, but there was no death of individuals, or that you have not received any reports for CMS, because we're trying to work behind the scene to see how we can contact CMS to make sure that you are receiving those reports, because that is required. Okay, thank you so much, Mary.
All right. Okay, for a number of interventions on behalf of groups of PAIMI eligible individuals impacted, once again, the fields will be blank, and you'll have to go in and enter the data and at least one case of intervention on behalf of a group. And for the final one in this section, end outcomes of PNA activities, the fields will be blank, and you have to enter the amount. All right. Before we move on, do we have any questions?
Yes, we have one question, Mary. For population information, I am not seeing an option for unknown for race, but it is an option for ethnicity. Last year, I believe it was an option for both. Not having a place to count the unknown races makes the total off. Should the unknown be included?
Okay, this form is part of the 4-year cycle for the new PPR. So whatever was in last year should be in this year. So let's go back to that. Okay, it's over here. Okay, it's unknown. So you're saying it's not under racial and ethnicity? It's right there. Go down. Okay. It's under ethnicity, but it's not specifically under race. Okay. But this is the exact form from last year. Anything else?
Any other questions, Crystal?
No other questions.
All right. All right, so moving on to the next section. Non-client directed advocacy activities. This is the only file table in this section. The fields will be blank and will be required. Grievance procedures, once again, the only item. And the fields will be blank. And there's just a couple things I did want to point out. The upload process, if you're uploading a document throughout WebBGAS, is the same. First, you choose a file. And I'm just going to upload the PPR instructions for today. And then once you've got your upload, you'll see the line, the title right here. You simply click on the upload button. All right, you can upload PDFs, Word documents, and Excel spreadsheets. Those are the 3 items that can be uploaded into the WebBGAS system. And you'll note here that it's documented. If this was done in error, it can be deleted at any time up until you submit the application to SAMHSA. And this process that I just showed you is the same throughout WebBGAS. So whenever you need to upload a document, that's how it's done. The other thing I did want to point out that here we have, you can add for number 6, please identify all individuals by name and title responsible for grievance reviews. And it says here you can have a maximum of 5. So once you enter the information for one, all you have to do, if you have up to 5 of them, you simply click on the add person and you can add another name. And that's how that works. So you can put in a total of 5. So I did want to show you that. There have been no changes or updates to this form. Okay. Other services, public comments. The fields will be blank. This table will be blank. And there has been nothing added or updated on this screen. Impediments. Once again, this is just document based, so you just need to go in and enter the information here. The fields will be blank. If you have nothing to enter, at least put an NA or none so you can save the screen. And finally, within this section, accomplishments, recommendation, and training needs. Once again, if you don't have any information, at least put an NA or none. And here you have a place to upload supporting documents for accomplishments. So if you have any documents you want to upload, you can do it here for accomplishments.
Hi, Mary. May I make a comment?
Yes, please.
Okay. I just want to emphasize in this section on the services, other services and activities. Please complete this with information, because this information is helpful to SAMHSA, as well as that some of this information is used to go into the biannual report that is included in the report that ACL published and provide to Congress. So this information is very important, so please try to complete it. Thank you so much.
All right. Now, for the budget section, the PAIMI budget, we will be porting over the data from the 2021 PAIMI application, and it will be editable. It will be editable. So there's a few things I do want to point out on this screen. You'll note that we've taken the header instructions, increased the font size, and put it in red. One of the problems people were having said they were having a hard time reading the instructions. So we increased it and placed it in red to make it a little easier to read. We've also increased the font size of each of the sections instructions to make them a little easier to read. So I did want to point that out. That is something that we've done that is new. Also, I want to point once again that for section 1, personnel, name, title, and it states in parentheses, active for PAIMI supervisor only. So only the PAIMI supervisor will be able to see and edit and add into section 1. A state user will be able to update, add, and see all of the other information. But for section 1 only, you must be a PAIMI supervisor or have that role to be able to look at this information. And as I said, it will be ported from the 2021 application and it will be editable. And it's very simple. All you do is each section has its own button. If I add on personal detail, I go in, I have a drop down, I can select who I'm going to be discussing. I can put in a number, put in the numbers, and then here, when you click on the comments box, you'll get an open screen and you can go in here and enter your information. Lisa, didn't you have something you wanted to state about the personnel section?
Yes. Well, yes, with the personnel section, please make sure that you do include the name along with the title and other information for each of the staff members, because we do review that closely. Also, when you're making the comments throughout this report, please make sure that it's detailed and self-explanatory. Also, please do not group items together or cost items together, because if we have a large sum of cost and there's no detailed explanation, again, we will have a revision request to come back to find out more information about it. So please make it as self-explanatory as possible in the comment section. Thank you so much.
Thank you. And also want you to note, as you put in the dollar amounts, the percentage is automatically calculated for you. The other item I did want to point out on this screen was at the bottom, section 10, the carryover for PAIMI funds only. We have one carryover. It will be blank and it is for FY 2020. It is for FY 2020. And you'll note here it says, please upload your budget plan for 2020 carryover funds. And we have the upload right here for your use. Okay. For the expenditures and revenues, this screen will be blank, but there's a couple things I also wanted to point out to you, and that was we have updated the screen. We have modified the screen slightly. You will note that here for question 1, PAMI program carryover of grant funds identified by FY. If I click on the add fiscal year now, before it was just a blank and you filled in the year, now we have it as a drop down and it's limited to 2 years. So you have 2019 and 2020. Those are the 2 years that you now have. So you can select 2019 and I'll go ahead and put in. And then if you need to, for 2020, once again, click on that box and select 2020 and enter your amount. Now, you'll notice also, please, that now the Add Fiscal Year button has grayed out. You cannot enter another fiscal year. So this question is now, or this statement is now limited to 2 fiscal years. To 2 fiscal years. And as you saw me do earlier, and once again, if you want to remove one, you can by simply clicking on the X. If I click on the X, I'll get the message at the top, are you sure you want to delete this record? And I click on OK, and it removes it. Other funding sources, identify each source. This is not changed. Once again, you can click on the add, come down and enter a name and enter an amount. So there
Okay,
have
we
been
have a
some.
comment.
Go ahead.
Oh, I'm sorry.
No,
No,
go
sorry,
ahead.
go ahead.
No, I'm done. Go ahead.
Okay, so okay, so I was just going to emphasize for number 3, the total of all PAMI program costs listed in 1 through 8 in the budget. That number should be exactly the same number for the total PAMI share in the budget in the itemized budget we just reviewed. So this number should be exactly the same. This should be the number for your FY 2021 funds that were used for the PAMI program, and anything that you use from carryover from FY20, again, you have to identify that number in the budget, and then you will have to upload your itemized listing of expenditures in the other budget form. Just want to emphasize that.
All right. And once again, I have saved it and it was saved successfully. PAMI program statement of priorities and objectives. The data from the 2021 application will be ported over and will be editable. And you'll note that you see these arrows? If you want to reorganize your priorities at this time, you can by simply, or your objectives, simply by clicking and then move them up and it'll move them down. So like I said, if you want to reorganize, that's how you can do it. The other thing I wanted to point out is at this time, you can go in and add your strategies. You click on the Add Strategies button, select the strategies that were used for this objective, and click on Save, and they will appear. And then for your target population, you're going to add your outcomes at this time. So there were 1,000 expected, and we got 1,000. So it was achieved. And at the same time, you'll note here, you can document if it wasn't achieved, why it wasn't achieved, and other information, accomplishments related to the above priority, and other qualitative narratives related to the above priority. Specifically, activity for which there were no quantifiable results. You can add those right here. If you need to, you can always add another narrative. If you have more information you want to enter, you can do so by adding another narrative. After you're done, simply click on Save. And the total actual outcomes will appear here, and whether it was achieved or not will appear here. And you'll be able to do this for all of your objectives and target populations that you have in your priorities and objectives.
All right, Mary, may I make a statement?
Yes.
Okay, so again, here we actually put this statement. This is a new statement here, the PAIMI program statement of priority and objectives as SPOs must be specific to individuals with significant mental illness, adults, and/or significant emotional impairment, children, youth, as determined by a mental health professional qualified under the laws and regulations of the state. And I think we have some additional information in accordance. So this statement is just basically to ensure that your PAMI program statement priorities and objectives, although they're being carried over from your application, again, please do not change them or modify them, because we're going to check them as the program officers to make sure that they are the same one that was approved, even the revisions that were approved by the end of September. So again, just remember that your SPOs should be the ones that were approved for FY 2021.
All right.
Thank you.
Mm-hmm. Now, and finally, the Advisory Council report. This is the last table in the application. You'll see here, if you want to, you can download a hard copy of the Advisory Council report. As I showed you in related documents on your dashboard, it's also there for you to download and to save. And then once you've downloaded it, completed it, you can use this upload box to upload the information back into WebBGAS. And then here you'll see, please use the box below to indicate areas of technical assistance needed related to this section. So related to the Advisory Council section, you can document that information right here. The other thing I did want to point out is that for the Advisory Council update information, we have updated this so it now matches what is on the hard copy of the ACR. All right, Crystal, do we have any questions?
No, we do not have any questions at this time.
All right, so I'm going to go ahead and move on. Now we're going to state we completed the application and we're ready to submit it to SAMHSA. The submission process is two-step. The submission process is two-step. The first thing we're going to do, as I stated before, if you wanted, as you were completing each form, you can simply mark them as complete. We already did the general information, so now it says to mark it as in progress, but we already marked it as complete. So as you go step by step through each form, you can mark them as complete. And as you do so, you notice the section progress will continue. Or if you wish, you can wait until you've completed all of the tables, and then you simply go into each section. And you'll see here, I'm going to mark them as complete. And as I do so, it shows you how the section goes green. So now it shows that this section is 100% completed. Even though you've marked them as complete, they remain editable. You can go in and click on modify, and that'll open the form, so you can go in, and if you need to, you can update or do whatever you need to the form. The forms, as I've stated before, remain editable up until the time you submit it to SAMHSA. I'm going to go through quickly and just complete all of these. All right. Now, you will note a change to the left-hand menu tree once I click on the final one, which is the Advisory Council. When I click on the complete, you'll notice that down here, it now says the P&A Supervisor Review button became active. So you have gone through and you have completed the application, and it's now ready for the supervisory review. Now, if you happen to be the supervisor that's completing the application, this may seem redundant, but this is the process for submitting to SAMHSA. So you come in here, and I would click on Supervisor. Once I have done, by clicking the P&A Supervisor, your application will be ready for the supervisor to review, and they'll be sent an email to let them know. So when I click on the supervisor review, an email has gone to the supervisor to do that review. If they find any information is incorrect, they'll come back to whoever and ask them to make additions or changes, corrections. But once that entire process is completed, you'll note that a P&A supervisor review has changed to submit to SAMHSA. So I'm going to go ahead and we're going to submit this to SAMHSA now. All right, so it's telling me the application was submitted successfully. So at this time, the application is now non-editable. You cannot go in and make any changes at this time. And you'll note that we now have, instead of submit to SAMHSA, we'll now see what we call revision requests. And that's what I'm going to cover next. But I'm going to go to another state where I already have everything all set up and ready to go. All right. So I'm going to come down. When your project officer at SAMHSA enters a revision request, and then they'll do what they'll click on send to state. And when they do that, you will get an email letting you know that you have a revision request. And here's where you'll come. You have a couple options, and I'm going to show you the first. The first is you come down to revision requests, and you'll note it's each section, so you can open it up by section. You can open or close all of the sections at one time. The thing I like to use, which I find easiest, is to use the filter. And you can filter by forms with revisions, forms without revisions, forms with revisions, and then for the different status, sent to state, in progress, completed, approved, or disapproved. I'm going to use forms with revisions. And it will open up only the forms that have a revision in some kind of status, as we see here. Sent to state, okay? So the revision has not been started yet. This is I just want to point this out. Once you've completed the revision and sent it back, your project officer will then review it. At that point, they will either approve it or they will disapprove it and send it back to you. And when it's disapproved, once again, you'll get an email informing you of that, and the information of why will be included in the email. But we have also added it to the screen itself. So the reason for disapproval is now right here. Because one of the issues that we've gotten feedback from people using it, that they have to go digging through the emails to see what the reason was for. And so we were asked to just go ahead and have that information placed on the screen. So when you come in for one that's been disapproved, the reason for the disapproval will be documented right here. And it has to do with a post disapproval. Okay. And then we have one here that's been completed. and it is now waiting for, when it says completed, it is waiting for the project officer to go in and do their review. And then we have one here that's open for revision. Now, if you wish, if you click on the view form screen or view form button, it will open up a second tab with the form. And the reason for the revision request is also here at the top of the form. And you can do everything from the form itself. Now, as I stated before, the form isn't editable until you start the revision. And once you start that revision, you can go in and edit your form and make any edits that you need to. Once all of that is done, once you've completed whatever the revision requested, you simply click on the Revision Complete button. And now all the permission you have to do is the view. Just please remember that you've got your second tab open here. And I can say this from personal experience. I will find myself, instead of going back here, I'll come down and click on revision request and start, and I'll have like 10 tabs open here at the top. So just remember that once you've completed that, you're going to click on the X box and it'll take you right back to the revision request screen. The other thing I wanted to point out is you can work from the revision request screen, or if you wish, you can go just directly to the table or screen itself, and you can just do everything from here. You don't have to go to the revision request screen. I leave that up to you. There are probably some of you out there that have been navigating in WebBGAS for a while, and you've got your own system set up. Whatever you're comfortable with is fine. I can't say there's any wrong way to navigate. Whatever you found easiest to do, continue to do that. I'm just here to show you some options. All right. And that is all I have. Do we have any questions?
No, Mary, no questions.
All right. Lisa, do you have anything else you'd like to add before we leave?
No, just glad that everyone attended, and I'm glad that we can help you today with this webinar.
Thank you all. I want to thank you all for joining us. And once again, as I've stated before, if you need any technical advice, please contact our help desk. They'll be more than happy to help you. They're very good at what they do. Or if you have any questions regarding the data to be entered, please contact your project officer. And with that, I'm going to wish you all a good day. I hope the rest of your day goes well. And we'll talk to you soon. Bye-bye.
All right. All right. Bye-bye, everyone. Thank you.